The Virginia Department of Health is reporting the Commonwealth's first measles case of the year. The patient is a child under 4 who recently traveled internationally.
Growing concerns about the measles, with at least 15 states now reporting cases from California to New York. Vermont and Maryland now seeing their first cases, and 2 new cases reported in Oklahoma.
When you get a large number of unvaccinated individuals with something as contagious as measles, it can spread very quickly.
A case was reported in Los Angeles involving a patient who had recently traveled through the Los Angeles International Airport. And health officials in California's Fresno and Madera counties say a case of the measles was confirmed with exposure to both counties. Texas, the hardest hit, with 223 confirmed cases and at least 29 people hospitalized, leading doctors to recommend children in outbreak areas get vaccinated at 6 months old instead of 1 year.
We're seeing a big push for that in the counties that are most impacted.
This coming after a child recently died from the measles, the first in a decade. The father telling The Atlantic that his 6-year-old daughter had been sick for 3 weeks. She died of pneumonia, a common complication from extreme cases of the measles. Health and Human Services Secretary Robert F. Kennedy Jr. saying he met with the family and is making sure anyone who wants a measles vaccine in Texas can get it.
What we need to do is give them the best information and encourage them to vaccinate.
But the well-known vaccine skeptic quickly following up with unsubstantiated claims about the shot's side effects and effectiveness.
What we are seeing with headlines is unfortunately the symptom of a larger problem about misinformation hitting parents who just want to do what's right for their children.
2 doses of the measles vaccine are 97% effective, according to the CDC. If a baby gets the vaccine at 6 months, they still have to get 2 more shots for full protection. Zoreen Shah, ABC News, Los Angeles.
15 states are now reporting cases of measles. Texas remains the hardest hit with 223 cases, and health officials have linked cases in New Mexico and Oklahoma to the Texas outbreak. A 6-year-old girl in Texas became the first U.S. measles death in a decade. Health officials say she was not vaccinated. Well, many people have questions about this measles outbreak, so we have Dr. Susan Giroir, director of the Norfolk Health District, with us right now to answer some of our questions. Thank you for taking some time to talk about, because a lot of people are talking about this.
Sure.
And the first thing that people think, well, I'm vaccinated, so how effective is this, and am I okay?
Well, the good news is the MMR, measles, mumps, rubella vaccine is very effective, one of the most effective ones we have. It's been around for decades and really has a great track record for safety as well as a great track record for efficacy. So it's 97% effective if you get your full 2 doses. That means of 100 people vaccinated, about 97 of them probably won't get the disease, or at least not severe disease.
You get that vaccine at what, 12 months? So if there is an outbreak or if someone comes down in your area with measles, should you get that vaccine a little bit earlier?
Well, most folks in this area, and the good news is we're a very vaccinated area. Hampton Roads has really done a great job. But at 12 months and sometime before kindergarten is when you get your second dose. And most of our kids, over 95% across Virginia and Norfolk Public Schools, probably over 97%, have been vaccinated by the time they're in kindergarten. So if kids, or even we're now adults, have gotten those 2 vaccines, we are fully protected for life.
Okay, because another question that people have is, well, should I get a booster? Now, I was talking to one doctor earlier this week who said some of the baby boomers may need a booster because they got the shot back in the 60s and maybe they only got 1, and it might not have been as effective. What do you say to that?
Yeah, I like that you're looking into that. It's a little bit complex, but the history is like this. Before 1957, there was no vaccine, and most folks, it's so contagious, most folks did get measles and therefore are protected for life. But there was a period between about 1963, 1968, where there was a different type of vaccine that was less effective. I would recommend that anyone who may have been born between 1963, 1968, that they certainly go and check with their provider if they should get another vaccine. They can do that by checking blood tests. They can do that by checking their vaccine records, but it's worth checking.
All right. And you don't look for this to be like another COVID pandemic, as some people, that type of an outbreak, because of the vaccination rates.
Yeah, well, it's not another COVID. It's not another COVID. We have a strong vaccine. Most of us are already vaccinated. It's not going to be the same thing. But I want to understand that there can be fear about that. And that's not something that should be taken lightly. Folks fear of having another pandemic and other vaccine mandates and all. But the good news is we're in a great position. It's a strong vaccine. Most of us are already vaccinated. So there may be pockets or individuals who haven't been or can't be vaccinated because of medical risks. And those need to take particular protections. Go see your doctor. There are things to do to protect yourself and your loved ones.
One of the questions people had was, if you had the illness as a child, are you okay? Are you still, could you still get the measles?
Yeah, well, first let me take a minute and let's think about all those people who got measles and that family who lost a child in Texas.
Okay.
It must have been devastating. So I understand that there are a lot of questions out there that want to be answers. Now back to your question. If you had it as a child, you will not get it again. You're actually quite well immunized if you had it as a child.
The vaccine came out sometime, I guess, like in the 60s. If you did not, you're a baby boomer and you haven't had the vaccine, you should get it, or what's the situation with that?
Yeah, the CDC guidelines say if you were born before 1957, you most likely were infected with the measles virus, so you do not need to be vaccinated again. Now, there's a small population between 1957 and through 1968 who maybe there's a question whether they got the vaccine, whether they were vaccinated appropriately. For those folks, they should probably go to their doctor, get a blood test and see if they were vaccinated. You can tell from the blood test, or just get another booster. But your doctor would be able to tell you that.
So if someone comes in and they say, and they feel like they're fully vaccinated, they say, can I get a booster? What's the situation? Do you turn them away, or should people even be concerned about that?
Well, most folks in the United States who were born after 1968 probably were adequately vaccinated. But I'm going to say you really need to go back and get checked out with your provider. If you don't have a provider, you can come onto the public health department and we'll help you out there.
Tell me what the symptoms are.
Okay. Well, there are two main phases of measles symptoms. The first one is start with a fever, some runny nose, bloodshot eyes, and a cough. It sounds familiar, doesn't it? A lot of things can present that way. A couple days after that starts, then there's this fairly typical rash. It can start around the hairline, move down the face, and move all the way out to the extremities. The fever is often really high.
And the other question that people had, where there's some people are saying, is this going to be like the COVID-19 outbreak? Can we compare the two? Completely different.
It's completely different. First of all, measles is probably not going to be a huge outbreak here in Hampton Roads. We are a well-vaccinated, very protected community. In fact, across Virginia, we have about 95% vaccination rates across all of our children going into kindergarten. So we're pretty protected. That's not what COVID was. So I think we're well protected. There may be a case here or there, but you know, if you're coming down with a rash, your child is, if they've been vaccinated, it's probably not measles.
All right. Thank you so much. We appreciate it.
Thank you.